In 1992, the USDA introduced a revised food pyramid that fundamentally changed how Americans were advised to eat. Interestingly, this new food pyramid was a collaborative effort between the USDA and the Department of Health and Human Services, or HHS. The Centers for Disease Control and Prevention, or the CDC, and the National Institutes for Health, NIH, are agencies under HHS. While these two agencies, the CDC and NIH, direct involvement in the development of the 1992 food pyramid is not explicitly documented, it's reasonable to assume that their research and public health data helped create the guidelines. While this guidance was marketed as a tool to improve public health, the decades since have seen a dramatic rise in chronic illnesses like diabetes, heart disease, and obesity. Meanwhile, two industries, big agricultural or big ag and big pharma, have reaped astronomical profits. To understand this decline in public health, we need to look at the role these industries, the decisions that shaped dietary guidelines, and how refined sugar and ultra-processed foods have played into this crisis. So for those that don't know, what are big ag and big pharma? Big agriculture or big ag. This term refers to the large-scale industrial farming operations and corporations that dominate food production in the U.S. to this day. Big ag includes companies that grow and process staple crops like corn, soy, and wheat, which are heavily subsidized by the government. Agricultural subsidies began in the 1930s as a way to stabilize food prices during the Great Depression, but they have evolved into a system that incentivizes the overproduction of these crops. These subsidized crops are often used to produce cheap processed foods, like high fructose corn syrup and refined flours, which dominate the American diet. These crops are also a cornerstone of genetically modified organisms, or GMOs, which are engineered to resist pests and increase yields, further tying big ag to the widespread availability of ultra-processed and genetically modified foods. Big pharma. This term encompasses the major pharmaceutical companies that develop, manufacture, and sell medications. These corporations have seen tremendous growth alongside the rise of the chronic diseases, as they produce drugs to manage conditions like diabetes, high blood pressure, and cholesterol. Rather than focusing on prevention or addressing the root causes, Big Pharma often profits from treating symptoms, creating a dependency on medications. So the 1992 food pyramid. Who decided and why? The 1992 food pyramid was created by the USDA, but it wasn't solely based on nutritional science. Influences from big ag, flawed research, and lobbying efforts shaped the final recommendations. And let's not discount that employees of the NIH who are deemed to be inventors of a new medication like a statin, diabetes drug, or weight loss prescription pill receive a royalty. The pyramid emphasized grains as the foundation of a healthy diet, recommending 6 to 11 servings per day, while fats and oils were placed at the top to be used sparingly. This guidance aligned with the interests of grain producers and processed food manufacturers, who benefited from increased consumption of refined carbohydrates. At the time, fats were widely blamed for heart disease based on incomplete research. This led to a push for a low-fat diet, which inadvertently promoted the consumption of sugar and refined carbs. The food industry immediately capitalized on this trend by marketing low-fat, high-sugar products as healthy, a misconception that persists to this day. The rise of refined sugar and ultra-processed foods. One of the most significant changes in the American diet since 1992 has been the pervasive addition of refined sugars in nearly all processed foods. Refined sugars are now found in products that traditionally never required them, like bread and sauces. And this is not by accident. Refined sugar has addictive properties, activating reward pathways in the brain and creating a cycle of cravings and overconsumption. This trend toward adding refined sugars to foods that didn't traditionally use them is primarily a U.S. habit. Most other developed countries have banned these practices. Now in the U.S., ultra-processed foods made from cheap, Subsidized ingredients like corn, soy, and wheat dominate grocery store shelves. These foods are marketed as convenient and affordable, but their nutritional content is horrible. Many ultra-processed foods offer little more than empty calories, with a dietary value comparable to fast food. And subsidized crops also serve as the foundation for many GMOs, which are used to increase shelf stability and resist pests, further embedding these ingredients into processed foods. And the widespread consumption of these products has contributed to skyrocketing rates of chronic illness. So what are the health consequences since 1992? Prediabetes and diabetes. In 1992, approximately 2.9% of Americans had been diagnosed with diabetes. By 2023, that number had risen to 11.3% of the population, 37.3 million people. Add to that, 38% of adults, or 97.6 million, now have prediabetes, with over 80% unaware of their condition. These trends are closely tied to diets high in refined sugars and carbohydrates, which lead to insulin resistance over time. Obesity. Obesity rates have more than doubled since the 1990s, now affecting 42% of U.S. adults. Again, this epidemic is driven by overconsumption of calorie-dense, nutrient-poor processed foods. Heart disease. Despite the low-fat push of the 1992 pyramid, heart disease remains the leading cause of death in the U.S. Processed foods high in sugar and refined carbs contribute to chronic inflammation, a key driver of heart disease. Big Ag and Big Pharma, a symbiotic relationship. The rise in chronic illnesses has created a perfect storm for profit for both Big Ag and Big Pharma. Big Ag profits from the sale of cheap, subsidized crops that are turned into processed foods. It encourages overconsumption through addictive ingredients like sugar and chemical additives. And Big Ag also produces GMOs that dominate the processed food market, further embedding their products in daily consumption. Big Pharma benefits from the residual health crisis by selling medications to manage diabetes, high cholesterol, and heart disease. It creates a dependency on lifelong treatments rather than addressing the root causes of illness. While direct collusion between these industries is kind of hard to prove, their systemic incentives align, perpetuating a cycle of poor health and profit. A comparison to other developed countries. Countries like Sweden and France have adopted stricter regulations on food additives and ultra-processed products, leading to better health outcomes. In Sweden, revised dietary guidelines to reduce sugar and processed food consumption and obesity rates are significantly lower, around 20%, compared to the 42% of the U.S. France emphasizes fresh, whole foods in both cultural practices and public health policies, and diabetes rates are far lower than in the U.S., with only about 8% of the population affected. Japan's focus on minimally processed foods like fish, rice, and vegetables has kept obesity rates below 5%, with some of the highest life expectancy rates in the world. So what can be done? Focus on whole foods by choosing unprocessed or minimally processed options like fresh produce, whole grains, and healthy fats. Grow your own food as much as possible to remove GMO products from your diet. Be sure to read ingredient labels at the store. If you can't pronounce the ingredients or it's got massive amounts of added sugars like this one does, chances are you don't need to be eating it. Understanding the forces that have shaped American dietary habits since 1992 reveals the need for systemic change. It also suggests, at the very least, a coincidental explosion of profits in the Big Pharma and Big Ag industries. And worst case scenario? Well, just look at the profits of these companies, who both had some input on the new food pyramid guidelines. By learning from other countries and making the personal choice to a return to whole, minimally processed foods, we can begin to reverse the tide of chronic illness and dependency on medications. And just maybe we can take a little bit of that hefty profit out of some pockets of people who claim to have our best health interests in mind.